During his administration, former President Donald Trump raised the height of the border wall to discourage people from trying to climb over. And now that's having an unforeseen effect. Good evening and thanks for joining us tonight. I'm Steve Price.
And I'm Kirsten Holmes. The border walls were raised to a height of 30 feet in some areas. You can see them behind me, and that's led to a huge spike in severe injuries from falls. CBS 8's Tim Blodgett has the story for you.
The latest iteration of the U.S.-Mexico border wall was designed to be higher and to prevent people from scaling it. But illegal border crossers are still finding a way over and falling from a much higher height.
And this was the one that was hardest to climb. We've all seen the pictures of young people climbing. This wall can't be climbed.
When then-President Donald Trump vowed to secure the southern border with hundreds of miles of new wall, there was several prototypes to choose from. Eventually, this design was picked. 18 or 30-foot high sections made of concrete and rebar steel bollards. But the wall that former President Trump said would be unclimbable still seems to have flaws. Social media footage shows young men with makeshift ladders climbing to the top of the wall, then sliding down the bollards on the other side. But not every brazen border crosser gets away so cleanly, and it can sometimes end with tragedy.
We had just in the last month alone a 20-some-year-old who died. Now, incidentally, that patient was COVID positive, but didn't die from COVID. It was the head injury.
Dr. Ghazala Sharif is the chief medical officer of acute care at Scripps Health. She says she's seen an alarming amount of new cases from falling injuries at the border wall.
In 2019, we had, maybe 5 border falls a month. It was really just a lower number. So in 2020, we had 41 border injuries, 41. This last year alone in 2021, we went up to 139.
A study released by UC San Diego Health on Friday broke down the exact numbers, showing 67 trauma-related incidents due to falls at the border wall from 2016 to 2017. That number climbed to 375 between 2019 and 2021.
And these are not just one broken bone. These are multiple fractures, head injuries, spinal cord injuries. So there's an immense toll that it takes on our surgeons and the patients.
People crossing the border illegally are desperate enough to risk life and limb to get into the United States. Consequences from the accidents not only affect the migrant, but put excess strain on the United States healthcare system.
And so then we keep bumping people down the chain, and these other patients get sicker as they're waiting. We just have to think about all the repercussions, not just alone of the border patients that are getting injured, but how it affects other patients as well.
Tim Blodgett, CBS 8.